Your healthcare professional will set up a feeding plan for your child. This plan will include the formula to use, how much to feed your child, and a schedule for feeding. In addition to formula, you'll need a feeding container. If the container does not have an attached feeding set, you'll need tubing to connect the feeding container to your child's feeding tube. Ask your child's healthcare professional how often you should replace the feeding set and container, and how you should care for them in between feedings. Always wash your hands to prevent contamination before preparing the formula and before touching the feeding tube, tube site, or feeding equipment. Wash with soap and water. Rinse thoroughly. Dry with a clean towel. Let's look at how you prepare the feeding.
What I usually do is I get his formula prepared, and then I put in about 8 ounces of water, and then I add 7 scoops of formula to the water, and then I put the lid on and shake it.
Measure the amount of formula for the feeding in a clear measuring cup. Write the date and time on the feeding container. Attach the feeding set to the container, if it is not pre-attached, and close the clamp. Pour the formula into the feeding container. Hang the container on an IV pole or wall hook. Cover any unused formula and write the date and time on it. Store it in the refrigerator. Follow the instructions for gravity feeding or pump feeding. Your child's healthcare professional will tell you which method to use.